Good afternoon, everyone. Welcome. My name is Anya Sanchez. I'm serving as panel moderator today. I'm also very fortunate to serve as one of the co-chairs of the OTR International Film Festival. And we are so fortunate to have the film festival in our own city. It really is truly the only one of its kind. I'd also like to thank LAD for being the organizer of the film festival. The mission of LAD is to empower our shared humanity through stories, conversations, and action. And that is exactly what we'll be doing today with this panel. I'd also like to thank today's sponsor, UC Health. UC Health is the region's only adult academic medical center, providing advanced specialty services, leading research, and also educating the next generation of healthcare professionals. So thank you to UC Health. With that, I would like to introduce today's panelists. We have with us today Dr. Rana Schatz, who serves as the Bob and Sandy Hyman Chair of Alzheimer's Disease Research and Education. She's also the UC Health Director of the Memory Disorders Center. We have Eric Van Vlymen, who's the Executive Director of the Ohio Alzheimer's Association. Then we have Karen Durgans, who is the impact producer of today's film. And then finally, last but not least, we have Dr. Joe Broderick, who is Professor of Neurology at the University of Cincinnati and also serves as the Director of the UC Gardner Neuroscience Institute. So thank you all for joining today. So I do have some questions, but please feel free to jump in at any time. Karen, I'll start with you today. You served as impact producer for today's film. So really curious, what was the impact that you want to make through this film? And I understand it's also personal to you. You have a personal connection to Alzheimer's disease.
Yes. My personal connection is a parent, a stepfather and a mother, Alzheimer's dementia, back to back, and just what that journey was like as they were going through it, but also the community and what opened up to us to understand the supports that were available and around was amazing and was critical for us at that time. It would have been extremely difficult to get through without the support and help that Alzheimer's Association type agencies bring. We're so grateful for what they do. And for Determined, when you have, there's nothing that engaged, committed leadership and participation can't accomplish. And from the very beginning of Determined, when Dr. Sager was talking to his wife and trying to figure out what direction to go with studies, it was very personal for him, and he felt it very passionately that his wife volunteered start with me. And from that, when you start with that kind of a personal connection, and then you move through with a producer who is a participant in the study, 15 years around that at this point, her commitment was she wanted the world to see what this journey was like. And if you participate in this journey, what can you accomplish? It's one thing to have a parent to see that struggle. It's another to actually be in the study trying to make a difference. So you've got at all levels, there's that level of accomplishment that is going out to encourage people. You can, regardless of the circumstances you're in, there is something you can do, there's something you can learn, and you can be empowered.
Fantastic. Dr. Schatz,
Yes.
You work with Alzheimer's patients and their families and caregivers every day. So what are the questions or the themes that you hear most often?
You know, I think the journeys of everyone in this film are the questions I get every day. There's everyone's experience. And I think despite in some ways, the diversity, some common things are people come to this so unprepared. Even in 2021, when we've known about this long, how much people still ask the very basic questions and still don't have that ability immediately to get the resources and services, and how much they suffer. I just think with the opening story, when the gentleman brought his wife home and really had no clue about what was going to happen, and nobody had given him the sort of navigation that you need. So I think we're still struggling with that idea still, that the two hands, we must do it, but we don't have the two, T-O-O, hands that we absolutely need.
Yeah. That's a great point and a great lead-in for you, Eric.
Segue, yeah.
Yeah, so a great segue. So what do you think about that, and what do you wish that patients and families really knew about the support that's available?
One, that it's there. Two, that it's for any level of dementia. Sometimes for us, they hear Alzheimer's Association, they assume, they have dementia, they haven't really determined what. But then just to take that step. And then the other thing we look for is people in the community. We try to engage the community to be able to reach more, because so many times people will reach out if they know somebody. And so sometimes it's, if you've gone through this and you've been helped and you know that, and that's what's so exciting about this film, is it's just another way to get the story out about the needs, the hope of research, but also that there is help. And that's really one of the most important things. I've watched caregivers' lives transformed through support group education. I've done this 20 years, and I've just watched people go from coming into our office crying, overwhelmed, and use the word empowered. And if we do our job right at the Alzheimer's Association, when they leave, we've empowered them with the information, and we offer the support to go along the road. So just because they've seen us once, that isn't the end of the journey. This is a 15-year journey. We'll walk that with them. And just trying to get people in to accept the help and then embrace it and then tell others is really important.
And that's got to be so reassuring for so many people to hear, who are like some of the families in this film that just that feel like they have to start from scratch. So,
yeah. And every time I see that, it breaks our heart, and that's the impetus for us to go out and reach more people.
Yeah, wonderful. So there were so many wonderful themes in this film, but one of them was really around research. And so, Dr. Broderick, you've been involved in research your entire career. You're a preeminent researcher. Can you speak to the importance of research, and also maybe another theme that was touched on was the importance of having diversity and an inclusive approach to research?
So research is the basis for how we get better at dealing with all the diseases we have in medicine. And Alzheimer's is a great example. It's one of the most resistant, long-standing, we know about it, but we've been working in it a long time. And you really have to be determined, that's the term, to make progress. The thing about research, what people don't realize, it's a partnership. It's not just a couple of smart researchers and doctors. It's people some who are trained to be the researcher, but working with both the patients and particularly the families. And Alzheimer's is one of those places where, as much as any, you have to have the family engaged. And the thing about research is the answer just doesn't come like in a week. You just don't set up an experiment and it's all done in a week. With Alzheimer's, when we're trying something to see if it slows down the disease, we're talking about years, particularly when people are only mildly affected, like with the recent drug. That is something it takes years to monitor. So it takes years to get it set up. It takes even more years to find something that may be working, and then a determination to get it done. And then we find sometimes that what we thought could work doesn't work. And then we go to the next thing, and that's what we've been doing for a long time with Alzheimer's. But without that engagement, without those patients and families, nothing ever happens. But when we have something that changes things, every person that participates in that line of research is making a difference going forward, not just for their own selves, and sometimes it's paying it forward. We may not even benefit from the research, but maybe your daughter, your grandson, somebody else that down the line will benefit tremendously from that research. The diversity issue is also really, really important because not everything works the same in every person. And even though and probably at some point in time we talk about personalized medicine, that this medicine may work for you, but may not work for you or you. Well, we're getting there. But even in a broader way, having diversity, make sure that whatever it is we're looking at works for everybody, or at least we know who it maybe doesn't work for. So it's important that we treat whites, blacks, Asians, Hispanics, old, younger, different types of causes maybe. So we want diversity. And unfortunately, I think for the Black community, the experience of research has been a negative one because of the Tuskegee and other things in the earlier times. And so it really takes a special extra effort to make sure that that can happen. One of the things you saw in the film is that sometimes having somebody who's Black talk from the research standpoint to patients and their family, that gives us some reassurance that this is not somebody taking advantage of somebody else. But we're all in this together. We all have to solve the problem. And we really have to be respectful of people as well when we do research. So some people don't want to participate, and that's fine. But for those that do, we are highly appreciative.
Okay, fantastic. Well, so maybe what I'd like to do is just go down the line and maybe speak to, what resonated the most for you with this film. And if there was one thing that you could say to the audience, support or advice, coming, because you each come from such unique perspectives, what would you like to impart to the audience today?
Well, I think this film brought up some very important concepts. One is that you should not be afraid to listen to what your body is telling you if you feel like there's some change. It takes courage to go and see somebody, but do it because, as one of the persons in the film found out, she didn't have what she thought she has, but she had other issues. Secondly, there was kind of I saw the beginnings of this idea that it is not inevitable. There's preventive measures that we all can take, even without a cure. I think there's too much emphasis on cure and not what are the incremental things we can do. Not just with medications that might be incremental, but what are all the healthy lifestyles? And that was, I thought, such a brilliant answer when one gentleman at the booth with the woman who represented the African American community talked about, answered the question, why is it so prevalent in our population? And she said, because of our health, our general health. And that is a really important, hopeful, kind of positive thing that everybody can look at and say, I can do this right now.
Mm-hmm. Wonderful.
I think for me, it's the theme of hope, right? So this idea of the spirit of being determined, you see it in the families, you actually see it in the researchers, and you see it in everyone involved. And the idea of hope, particularly for Alzheimer's, is the hope of the disease having a cure, having better markers. We're doing the U.S. Pointer study to look at, those kind of health markers that we can do. It has to start today. And hope isn't something that we're going to get at tomorrow. And so to be determined, you have to say, I think about the families I've worked with, their parents weren't even diagnosed. They had no idea what this disease was. It had all sorts of names. And then they get it. I remember we had a support group leader whose mom had it. She was a chair of our board, and she was having difficulties running the support group, and she ended up having the disease, right? And so now her generation, her chance is lost. So this generation of families have an opportunity to look ahead and help by investing in research, by being a part.
I think the whole idea of community-based participatory research that Dr. Sager and his team envisioned from the beginning. Well, they envisioned it from the beginning, but as Gina Green Harris, the African-American woman who spoke so eloquently, as she pointed out, at one point, African-Americans were not even thought about in terms of being included in the study. I think the thing that really stood out to me was the fact that once they realized that that wasn't happening, they became willing to do something about it. But it wasn't just a willingness, it was a willingness that had feet to it. And it was a commitment that went longitudinally. And when you have the elements of building trust, people can see that. And they're more likely to want to participate if they see that you really mean what you say you mean. And I think Dr., well, I don't know if she's doctor, but Gina Green Harris just pointed that out so very well.
Yes. And then Dr. Broderick?
Well, so one of the reactions I had when I watched the movie was, oh my God, those tests are hard. So my wife said the same thing. She goes, oh my gosh. And so I want to reassure people. People see the movie, oh my God, I may have Alzheimer's disease. I couldn't possibly copy all those figures. And the point is they choose something that is extraordinarily hard because you want to make sure you catch the top ceiling of things. Yeah. And so that's why when she said I couldn't copy things, you say, oh, you don't have Alzheimer's, you're fine. Yeah. But when you look at those tests, you say, oh my gosh, I'm a doctor and that's really hard. I don't think I could do that. So that was one thing. But the other thing that struck me was the one woman who said, you can do LPs, MRs, whatever. The thing I worry about most is my thinking that I'll fail the test and somehow then there's that fear that I have this problem, particularly if it's run in the family. Right. And it's that fear that I think is paralyzing. And somehow to address that fear that people have that they're going to have what mom had or dad had or whatever, or even for the first time themselves, that's the thing that as physicians, that as the community, we need to address that. Even if you start to have changes and you may even have the disease, that doesn't mean life can't be full of quality moments. And it doesn't mean you don't stop living, but fear kills. Fear is the mind kill. Fear is the thing that destroys lives. And if we can address that, I think we can do as much as any medicine that we have that may be in the future.
That's wonderful.
Wonderful. All right, well, thank you all so much for joining us today. Thank you to LAD and the OTR International Film Festival. Thank you to UC Health for sponsoring our film today, Determined.